Can a ketogenic diet do more than just help you lose weight? What is the craze over this ketogenic diet thing? This is the first part in a multi-part series on Keto 101 on my channel. I'm going to be exploring the ketogenic diet in terms of helping you lose weight, reduce chronic inflammation, sustain your weight loss, improve your metabolic health, and reduce your risk of other chronic diseases like type 2 diabetes, obesity, and insulin resistance. Unlike other diets, the ketogenic approach works by shifting your body from being a glucose burner to a fat burner using the power of ketones. So, let's get started. So in 1977, the USDA introduced new food guidelines. We call it the food pyramid. This is the food pyramid that has been used to guide food policy in the United States and other countries, and is widely responsible for how we feed our children in their school lunchrooms, how we feed the elderly in nursing homes and residential centers, in hospitals, how we feed our military when they're on deployments. It's a pretty powerful set of food policies. As you can see, the base of this pyramid are things that we actually grow in the United States, which are a lot of grains and corn. The food pyramid actually was based on a lot of the farm subsidies that were being done in 1977, and not on research evidence or health research. As you can see by the second tier of this pyramid, there's our fruits and vegetables. Okay, that's good. But then towards the top of the pyramid is when you get to your protein sources. And guess what? At the very top of the pyramid, there's sugar. It's interesting that the USDA actually put a daily requirement for sugar on their food pyramid. So the food pyramid, as I said, was not developed by doctors or scientists, but by politicians. It was primarily written and created by one of Senator McGovern's aides, who was a vegetarian. It was in response to Senator McGovern's own opinions on diet and not on science. The food pyramid actually was rejected by the scientists who served on the committee. It was funded by the sugar and pharmaceutical industries and has never been proven to improve health in one clinical study since 1977. Yet, this is what we've been using in the U.S. to guide our food policy. So how's that been working for us? Well, as of 2021, and of course here in 2025, these numbers will be even worse. But only 12% of the American population enjoys good metabolic health, which means over 88% of all Americans have at least one chronic condition. Healthcare costs in 2021 were more than $1.72 trillion, which is almost 10% of our gross domestic product. Diabetes has risen exponentially. I call type 2 diabetes the gift you give yourself. I don't mean to sound flippant at all, but type 2 diabetes is an acquired condition. It's based on what you eat. More than 100 million U.S. adults are now living with diabetes or prediabetes, according to the data released by the CDC. 84 million have prediabetes that often goes untreated, but leads to type 2 diabetes within 5 years. These are acquired conditions. So this graph kind of shows the state of diabetes in the US. You can see that we used to have very low levels, but starting in, get this, 1977, you can see the steep rise in the prevalence of type 2 diabetes in the US. Happened about the same time as the food pyramid. So really, how does diabetes start? I'll bet those listening can say that your doctor has never tested your fasting insulin. Why is this? Well, in the United States and other countries, hemoglobin A1C has been the only number that we've paid attention to in terms of risk for diabetes. However, insulin is the hormone that's secreted by your pancreas, and it is responsible for controlling your blood sugar. So doesn't it make sense that if you have normal blood sugars, but your insulin is double or triple or quadruple what it should be, that your pancreas is working really hard to control your blood sugar? These people are, in fact, diabetic and don't know it. So in metabolic health, like when I practice, we test fasting insulin to see how hard is your pancreas working to keep your blood sugar under control. For those who live with sustained elevated levels of insulin, as this graph shows, your glucose will be controlled for a while, but then your pancreas starts to kind of wear out, and therefore the insulin can no longer control your blood glucose. Your insulin levels plummet and your glucose levels rise. Then you have type 2 diabetes. As of 2021, 2/3 of all Americans are either overweight or obese. The US then became the #1 wealthiest, sickest, and most obese nation in the world. It used to be that the diagnosis non-alcoholic fatty liver disease was only given to children. Only given to adults, but now we give it to children ages 8 to 10 years old. And fatty liver disease used to only be associated with drinking too much alcohol. But now children are being diagnosed with it due to the food additives and foods that they're eating every day. What about cancer? Well, as of 2018, over 1,700,000 cases were reported, with almost 600,000 cases dying every year, according to the CDC. These levels have also risen exponentially. This slide is very tiny because there's a ton of diagnoses on this slide. And these aren't all of them. These are the diagnoses that can be associated with insulin resistance, poor blood sugar control, and your diet. So you can see a lot of these are things that have become very prevalent in the United States and worldwide. Metabolic syndrome is kind of a brand new diagnosis. You have to have 5 elements to qualify for the diagnosis, and actually if you only have 3 of these, you qualify. So these elements include high triglycerides, low HDL, a large waist measurement, For men, it's over 40 inches. For women, over 35 inches. Why is that important? Because insulin resistance, one of the hallmark features, is that you put on fat around your internal organs, around your middle. High blood pressure also qualifies you for this diagnosis, and high blood sugar. You notice that LDL is not on this list. It's not one of the criteria. So remember, you have to only have 3 out of 5 of these to qualify for the diagnosis. So what does the ketogenic diet do? Well, it raises your LDL, the good cholesterol. It lowers your triglycerides, which are the damaging fats floating in your bloodstream. It decreases your blood pressure, decreases the fat around your abdomen, and decreases your blood sugar. Isn't that interesting? The 5 major improvements seen with a ketogenic diet are also the 5 major symptoms of metabolic syndrome. So here's a saying by Gary Fettke that I think is very good. It kind of reminds us of an overall concept. So sugar makes you hungry. Carbohydrates make you fat. Polyunsaturated oils make you inflamed and sick. Dr. Ballerstedt said, the problem is not the grain-fed cattle, it's the grain-fed humans. And Dr. Saul has said, good health makes a lot of sense, but it does not make a lot of dollars. So, common sense. Where you're viewing this video, shout out these answers. If you're gluten intolerant, you avoid what? Gluten, that's right. If you're lactose intolerant, you avoid dairy and dairy with lactose. If you're allergic to seafood, you avoid seafood. If you're carbohydrate intolerant, that is, you have type 2 diabetes or Parkinson's, Alzheimer's, obesity, PCOS, IBS, cancer, arthritis, what do you avoid? Carbohydrates. So my final tips and takeaways are things you've seen on my channel all the time. Reduce your daily carbohydrate and sugar intake to reduce your insulin resistance and level of inflammation. Adopt a low-carb, healthy-fat ketogenic diet. Take those carbohydrates down to a level that controls your glucose. Some people can do this eating 100 grams of carbohydrates per day, where others have to take your carbohydrates down to below 20 grams per day. How are you going to know? Well, obtain a blood glucose and ketone meter to test your blood in the morning. This is a clear way to see how's your body liking the level of carbohydrates you're eating. Increase your daily intake of healthy fats to increase your blood ketones, and healthy fats are things like butter, lard, beef tallow, olive oil, coconut oil. Get rid of all the processed foods, sugary drinks, sugary juices, and grains in your diet. They're very inflammatory, and they spike your glucose, which also elevates your insulin. Begin a daily exercise regimen, including aerobic exercise 2 to 3 days a week and resistance training 2 to 3 days a week. Try adding daily coconut or MCT oil to elevate your ketones, and institute intermittent fasting, either a 2 meals a day plan, which is a 16-8 fast, fasting 16 hours overnight, or a 1 meal a day plan, which could be a 20 to 23 hour fast. Thank you for viewing part 1 of Keto 101, a 6-part series posted on my channel in summer 2025. If you have questions, please email me at melanietidman@gmail.com and check out my other videos on my channel. I'll see you on the next video, which is part 2.